This is Dan Davis, and you can find me at danieldavislmft.com. Today I'm going to talk about exceptional patients, being an exceptional patient. A doctor named Bernie Siegel is an oncologist, a gentleman who treats cancer, a doctor who treats cancer, and he studied what exceptional patients were back years ago. And basically the idea is you do the things, you do a lot of the little things, following through on your treatment plan, and also other things, your diet and exercise and your sleep, and looking psychologically at things, not just following through on some of the medical treatment or psychological treatment in this case. So how do you become an exceptional patient? Well, there are a number of things I think that come to mind for me when I think about that. And certainly in terms of managing your emotional health too. How do I, as a person, make sure I'm managing my emotional health and I'm not just relying on one person to tell me what to do? So I think the first thing is you want to pick, in terms of doctors or mental health professionals, somebody that you feel like you like as a person, somebody who you feel like likes you, and also somebody you feel like can help you. You have confidence that what they know and what they know how to do is going to help you get better from whatever you're experiencing. And the next thing is you want to ask questions, and you want to have a professional you're working with that is comfortable with you asking hard questions. This is important for you to get your answers addressed. And some doctors this really upsets them that you ask difficult questions, but as a patient is what helps make you an exceptional patient. The other thing is you want to educate yourself. You want to try to get good information on research, on solid research that gives us information about health, both psychologically and physically, about food, about exercise, about sleep, about epigenetics, about all the new things that are coming out that we can learn about and help ourselves. And if we have a specific disorder like depression or diabetes or anxiety, that we learn on our own about these things, because it can affect our progression to learn more and be more proactive about what's happening to us. Another great idea is to keep a journal, is to keep track of what is suggested by your doctor, your counselor, by your psychiatrist. And when you try it, if you decide to try it, fully follow through, and then notice what are the consequences or what are the results that appear to be happening as a result of what I'm doing. And then another thing is to have various advisors around you. So in the case of mental health, you can have your psychiatrist who may be working with medication or supplements. You can have your counselor or psychologist or a social worker or another clergyman, whoever's working with you, and they can be another part of your team. And you may have another person, your medical doctor, or you may have a nutritionist, or you may have a massage therapist or a body worker, and all these people can be advising you, and it gives you just another person to run situations by or run ideas by and see what they think about it, what have they learned about it. So having a group of advisors helps. Not being afraid of getting second opinion. No doctor has the final word on any disease, on any treatment, and to get more information is helpful. Getting a good second opinion is also helpful. When you get a second opinion, try to make it somebody who you think you're more confident that can be helpful for you. Even if you're trying more alternative techniques, that you feel like this is somebody who gets results from their patients. And the best way to find that is talk to patients who have progressed with medical or psychological professionals. And then also, as a patient, it's important to follow through on treatment suggestions. You know, you can reject a treatment suggestion, say, no, I don't want to do that. It's not going to work for me to do this. I don't have time to exercise. I don't have the ability to buy organic food, or whatever a person suggests. You can reject it, but if you have the resources and time to do it, and you think it makes sense, then work at developing a habit around that. Follow through on it. And then notice, put in your journal whether it works or not. This is really important if you want to be an exceptional patient. So these are the kinds of things that really help probably about 10% of people, just a guess, really progress so much faster than other patients. If you want to be in that group, then these are the kinds of things that get you there. This is Daniel Davis, and you can find me at danieldavislmft.com.